CPR, AED, and first aid basics. Sudden cardiac arrest is one of the leading causes of death in the U.S. Over 350,000 people will suffer from sudden cardiac arrest this year. It can happen to anyone, anytime, anywhere, and at any age. Cardiopulmonary resuscitation, or CPR, is a life-saving technique useful in many emergencies, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. The American Heart Association recommends that everyone, untrained bystanders and medical personnel alike, begin CPR with chest compressions. It is far better to do something than nothing at all. If you're fearful that your knowledge or abilities aren't 100% complete, remember the difference between your doing something and nothing could be someone's life. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. A person may die within 8 to 10 minutes. CPR can keep oxygenated blood flowing to the brain and other vital organs until a more definitive medical treatment can restore a normal heart rhythm. Before beginning CPR, check, is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and 2 people are available, one should call 911 or the local emergency number, and one should begin CPR. If you are alone and have immediate access to a telephone, call 911 before beginning CPR, unless you think the person has become unresponsive because of suffocation, such as from drowning. In this special case, begin CPR for 1 minute and then call 911 or the local emergency number. If an AED is immediately available, deliver 1 shock if instructed by the device, then begin CPR. Compressions restore blood circulation. In order to do compressions, you will put the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Place the heel of one hand over the center of the person's chest between the nipples. Place your other hand on top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms, as you push straight down or compress the chest at least 2 inches or 5 centimeters. Press hard and fast at a rate of about 100 compressions per minute. If you haven't been trained in CPR, continue chest compressions until there are signs of movement or until the emergency medical personnel take over. If you have been trained in CPR, go on to checking the airway and rescue breathing. Now let's watch this video demonstration.
Someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
Next, we are going to look at the automated external defibrillator, also known as AED. An AED is the only effective treatment for restoring a regular heart rhythm during sudden cardiac arrest, and it's easy to operate for someone with no medical background. Time is of the essence. The average response time for first responders once 911 is called is 8 to 12 minutes. For each minute defibrillation is delayed, the chance of survival is reduced by approximately 10%. An automated external defibrillator, or AED, is a lightweight, portable device that delivers an electric shock through the chest to the heart. The shock can stop an irregular heart rhythm and allow a normal rhythm to resume following cardiac arrest. Sudden cardiac arrest is an abrupt loss of heart function. If it is not treated within minutes, it quickly leads to death. Most sudden cardiac arrests result from ventricular fibrillation. This is a rapid and unsynchronized heart rhythm starting in the heart's lower pumping chambers, also known as the ventricles. The heart must be defibrillated quickly because a victim's chance of surviving drops by 7 to 10% for every minute a normal heartbeat isn't restored. Why are AEDs important? AEDs make it possible for more people to respond to a medical emergency where defibrillation is required. Because AEDs are portable, they can be used by non-medical people. They can be made a part of an emergency response programs that also include rapid use of 911 and prompt delivery of cardiopulmonary resuscitation. All three of these activities are vital to improving survival from cardiac arrest. How does an AED work? A built-in computer checks a victim's heart rhythm through adhesive electrodes. The computer calculates whether defibrillation is needed. If it is, a recorded voice tells the rescuer to press the shock button on the AED. This shock momentarily stuns the heart and stops all activity. It gives the heart the chance to resume beating effectively. Instructions guide the user through the process. AEDs advise a shock only for ventricular fibrillation or another life-threatening condition called pulseless ventricular tachycardia. Who can use an AED? Non-medical personnel such as police, fire service personnel, flight attendants, security guards, and other lay rescuers who have been properly trained can use AEDs. Are AEDs safe to use? AEDs are safe to use by anyone who's been trained to operate them. Studies have shown that 90% of the time, AEDs are able to detect a rhythm that should be defibrillated, and 95% of the time, they are able to recommend not shocking when the computer shows defibrillation is not indicated. Now let's look at how you use an AED.
Every second matters. Knowing how to use an automated external defibrillator, or AED, can mean the difference between life and death. The good news: AEDs are designed to be simple and easy to use, even if you have no medical training. In this guide, we'll walk you through the steps to use an AED effectively so you can act fast and confidently in an emergency. An AED is a portable medical device that delivers an electric shock to someone experiencing sudden cardiac arrest. The device analyzes the heart's rhythm and determines if a shock is necessary to restore a normal heartbeat. AEDs are commonly found in public places like schools, offices, shopping centers, and gyms. They provide clear voice and visual instructions to guide users step by step. Step 1. Assess the situation. If you see someone collapse, the first step is to ensure the area is safe for both you and the victim. Check for responsiveness by tapping the person and shouting. If they are unresponsive and not breathing normally, they may be experiencing sudden cardiac arrest. Step 2. Call for emergency help. Dial 911 immediately and, if possible, ask someone nearby to retrieve an AED. Early emergency response is critical to survival. Step 3. Retrieve and turn on the AED. Once the AED arrives, open the device or press the power button to turn it on. Follow the AED's voice and visual prompts carefully. Step 4. Attach the electrode pads and analyze the heart rhythm. Remove any clothing from the person's chest, including undergarments if necessary. Peel the adhesive electrode pads and place them as shown on the diagrams provided by the AED. The AED will then automatically detect the heart's rhythm. Do not touch the person while the AED is analyzing. This step determines whether a shock is needed. Step 5. Deliver a shock and perform CPR if needed. If the AED advises a shock, make sure no one is touching the victim. Press the shock button if prompted, or allow the AED to deliver an automatic shock if it's a fully automated model. After delivering a shock, begin chest compressions if instructed by the AED. Push hard and fast in the center of the chest at a rate of 100,120 compressions per minute. Continue following the AED's instructions until emergency responders arrive and take over. If the person regains consciousness, keep them as comfortable as possible. Common mistakes and how to avoid them. Not calling 911. Always call for emergency help before using the AED. Incorrect pad placement. Follow the AED's diagrams carefully to ensure proper placement. Hesitation. AEDs are designed to be safe and easy to use. Trust the device's instructions and act quickly. Why AED training matters. While AEDs are user-friendly, taking an AED training course can boost confidence and effectiveness in an emergency. Many workplaces, schools, and community centers offer training to ensure more people are prepared to respond. By understanding the steps involved and avoiding common mistakes, anyone can provide critical assistance during a cardiac emergency. Take the time to learn more about AEDs, practice using them, and consider getting trained. Visit AED.us to learn how you can help make your community safer.
Monday.com.
Now we are going to look at basic first aid. First is basic first aid for bleeding. Almost all bleeding can be controlled. Mild bleeding will usually stop on its own. If severe bleeding is not controlled, it may lead to shock and eventually death. First thing that you would do is cover a wound with gauze or a cloth and apply direct pressure to stop the blood flow. Don't remove the cloth. Add more layers if needed. The cloth will help clots form and to stop the flow of the blood. You want to elevate the point above the heart. Use pressure points. And in most cases, applying a tourniquet may do more damage to the limb than good. The 2010 American Heart Association guidelines also discount the value of elevation and using pressure points. Basic first aid for burns. The first step to treating a burn is to stop the burning process. Chemicals need to be cleaned off. Electricity needs to be turned off. Heat needs to be cooled down with running water. Sunburn victims need to be covered up or to go inside. No matter what caused the burns or how bad they are, stopping the burn comes before treating the burn. Take these first aid steps. Flush the burned area with cool running water for several minutes. Do not use ice. Apply a light gauze bandage. Do not apply ointments, butter, or oily remedies to the burn. Take ibuprofen or acetaminophen for pain relief if necessary, and do not break any blisters that may have formed. Basic first aid for blisters. Whether or not a blister needs any treatment is debatable. If the blister is small, unbroken, and not very painful, it is probably best to leave it alone. Cover it to prevent continued rubbing and pressure on it so that it can cause it to swell and possibly burst on its own. If the blister is large or painful, especially if the activity isn't finished, such as you are in the middle of a hike, follow steps to drain and dress a blister. To drain, you would use a sterilized needle and make small punctures at the edge of the blister and express the fluid. Then apply antibiotic ointment and cover it to protect it from further rubbing and pressure. Basic first aid for fractures. All extremity injuries need to be treated as broken bones or fractures until an X-ray can be obtained. There are all kinds of broken bone myths, such as not being able to walk on a broken leg or whether there's a difference between a fracture and a break. If you don't have Superman's X-ray eyes, treat it like it's broken. Take these steps for a suspected fracture. Don't try to straighten it. Stabilize the limb using a splint and padding to keep it immobile. Put a cold pack on the injury, avoiding placing ice directly on the skin. Elevate the extremity and give anti-inflammatory drugs like ibuprofen or naproxen. Basic first aid for sprains. The symptoms of a sprain are almost exactly the same as that of a broken bone. When in doubt, first aid for sprains should be the same as for broken bones. Immobilize the limb, apply a cold pack, elevate it, take anti-inflammatory drugs, and see your doctor for further diagnosis and treatment. Basic first aid for nosebleeds. Most of us have had a bloody nose at some time in our life. It simply means bleeding from the inside of the nose due to trauma. The biggest cause of a nosebleed is digital trauma, otherwise known as picking it. The first aid for nosebleeds includes lean forward, not back. Pinch the nose just below the bridge. Don't pinch the nostrils closed by pinching lower than that. Check after 5 minutes to see if bleeding has stopped. If not, continue pinching it and check after another 10 minutes. You can also apply a cold pack to the bridge of the nose while pinching. Basic first aid for seizures. First aid for a seizure is aimed at keeping the person safe until the seizure stops on its own. Most seizures last from 30 seconds to 2 minutes. Stay calm and reassure bystanders. Loosen any clothing around the person's neck, such as ties, jewelry, etc., that may impede breathing. Do not restrain the person. This may result in injury. And do not put anything in the person's mouth. Do not try and hold the tongue or force the mouth open. This may also cause injury. Clear the area around the person and remove any objects that could injure them, such as glasses, furniture, etc. Put something flat and soft under the person's head, and after the seizure, lay the person on the side to facilitate breathing and keep the airway open. Do not leave a person alone after a seizure. They may be disoriented and confused. If the person is known to have epilepsy, it may not be necessary to call 911. However, do call 911 if the seizure lasts longer than 5 minutes, another seizure begins soon after the first one ends, the person does not awaken after movements have stopped, the person has another medical condition such as heart disease, or you think anything else might be wrong. Basic first aid for bee stings. Bee stings are either annoyingly painful or deadly, depending on if the victim is allergic to the venom. Use these bee sting first aid tips. First, get the stinger out any way you can to prevent more venom from being delivered. It is a myth that any particular way is. If the person is known to be allergic to bee stings, use an EpiPen to prevent anaphylaxis or call 911 if none is available. Use a cold pack to reduce swelling at the site, but take care not to cause frostbite. Use an antihistamine like Benadryl to reduce swelling and itching. Try ibuprofen or Tylenol or acetaminophen for pain. And monitor the person who was stung by signs of anaphylaxis, including hives, redness or itching in other areas of the body, and shortness of breath. This concludes our training on basic first aid and CPR. Recognizing and reporting elder abuse. What is elder abuse? As defined by the Centers for Disease Control and Prevention, elder abuse is an intentional act or failure to act that causes or creates a risk of harm to an older adult. An older adult is someone aged 60 or older. The abuse often occurs at the hands of a caregiver or person that the elder trusts. The Elder Justice Act defines elder abuse as the knowing infliction of physical or psychological harm, or the knowing deprivation of goods or services that are necessary to meet essential needs or avoid physical or psychological harm. Elder means an individual aged 60 or older. All 50 states have some form of elder abuse prevention laws. Laws and definitions of elder abuse vary by state, and state statutes are accessible through this link. In Georgia, the willful infliction of physical pain, physical injury, mental anguish, unreasonable confinement, or willful deprivation of essential services to a disabled adult or elder person. This is going to include exploitation, which is the illegal or improper use of a disabled adult or elder person or that person's resources through undue influence, coercion, harassment, duress, deception, false representation, false pretense, or other similar means for one's own or another's profit or advantage. Neglect is the absence or omission of essential services to the degree that it harms or threatens with harm the physical or emotional health of a disabled adult or elder person. Sexual abuse means the coercion for the purpose of self-gratification by a guardian or other person supervising the welfare or having immediate charge, control, or custody of a disabled adult or elder person to engage in any of the following conduct. Lewd exhibition of the genitals or pubic area of any person. Flagellation or torture by or upon a person who is unclothed or partially unclothed. Condition of being fettered, bound, or otherwise physically restrained on the part of a person who is unclothed or partially clothed, unless physical restraint is medically indicated. Physical contact in an act of sexual stimulation or gratification with any person's unclothed genitals, pubic area, or buttocks, or with a female's nude breasts. And defecation or urination for the purpose of sexual stimulation of the viewer, or penetration of vagina or rectum by any object except when done as a part of a recognized medical or nursing procedure. There are 6 different forms of abuse that occur in people over the age of 60, including physical abuse, sexual abuse, emotional abuse, neglect, abandonment, and financial abuse. Physical abuse is the use of physical force that may result in bodily injury, physical pain, or impairment. Signs of physical abuse are the following: bruises, black eyes, lacerations, restraints, or rope marks, broken bones and fractures or skull fractures, sprains, dislocations, or internal injuries or bleeding, open wounds, cuts, punctures, or untreated injuries in various stages of healing, laboratory findings of medication overdose or underutilization of prescribed drugs, and elders reporting of being hit, slapped, kicked, or mistreated, an elder's sudden change in behavior, the caregiver's refusal to allow visitors to see an elder alone. Sexual abuse is non-consensual sexual contact, or sexual contact with a person incapable of giving consent is also considered sexual abuse. Signs and symptoms of sexual abuse include bruises in various stages around breasts and genital area, unexplained vaginal or anal bleeding, unexplained genital infections or venereal diseases, torn, stained, or bloody underwear, or an elder's report of being sexually raped or assaulted. Emotional abuse. Emotional or psychological abuse can include constant harassment, verbal abuse, and humiliation, isolation from friends and family, or deprivation of physical and economic resources. Signs and symptoms of emotional or psychological abuse include being extremely withdrawn and non-communicative or non-responsive, being emotionally agitated and upset, unusual behavior usually attributed to dementia, like sucking, biting, or rocking, and an elder's report of being mistreated. Neglect. Neglect is the refusal or failure to fulfill any part of a person's obligations or duties to an elder. This includes the refusal or failure to provide an elderly person with such life necessities as food, water, clothing, shelter, personal hygiene, medicine, comfort, personal safety, or other essentials included in an implied or agreed upon responsibility to the elder. Neglect includes failure of a person who has fiduciary responsibilities to provide care for an elder, or failure on the part of an in-home service provider to provide necessary care. Signs and symptoms of neglect include dehydration, malnutrition, untreated bed sores or poor personal hygiene, unattended or untreated health problems, hazardous or unsafe living conditions, or arrangements like improper wiring, no heat, or running water, unsanitary and unclean living conditions like dirt, fleas, lice on the person, soil bedding, fecal or urine smell, or inadequate clothing, as well as an elder's report of being mistreated. Recently, there was in the news, a caregiver was charged with neglect after a woman was found dead inside of a Forest Park home. She was actually under the care of a home care program where she was assigned to a CNA to take care of her. Abandonment is the desertion of an elderly person by an individual who has assumed responsibility for providing care for an elder, or by a person with physical custody of the elder. Signs and symptoms of abandonment include the desertion of an elder at a hospital, a nursing facility, or other similar institution, the desertion of an elder at a shopping center or other public location, and an elder's report of being abandoned. Financial abuse or exploitation. Financial exploitation includes illegal taking, misuse, or concealment of funds, property, or assets of a vulnerable elder. Signs and symptoms of financial abuse or exploitation include unexplained sudden transfer of asset to a family member or someone outside of the family, an unexplained disappearance of funds or valuable possessions, unauthorized withdrawal of elder's funds using the elder's ATM card, sudden changes in bank account or banking practice, including an unexplained withdrawal of large sums of money by a person accompanying the elder, an elder's report of financial exploitation, substandard care being provided or bills being unpaid despite the availability of adequate financial resources, discovery of an elder's signature being forged financial transactions for the titles of his or her possessions, the inclusion of additional names on an elder's bank signature card, abrupt changes in a will or other financial documents, sudden appearance of previously uninvolved relatives claiming their rights to an elder's affairs and possessions, and the provision of services that are not necessary. Different current events. Charges of financial abuse were recently filed against a former PSA by a family member of a client. The PSA used the client's credit card to purchase items for herself. This happened over a period of several months. The PSA was taken to court and found guilty of felony charges. The PSA will be on court-ordered probation for 2 years. They are not permitted to work as a professional caregiver ever again, and the immigration status could also be affected by the guilty conviction. Who is the abuser? Abuse tends to occur when stress levels of the caregiver is increased as a result of worsening of the elder's impairment. The abuser is family members in 90% of the cases where the perpetrator is known. And substance abuse is the most frequently cited risk factor associated with elder abuse. What is self-neglect? Vulnerable adults, such as senior citizens who neglect themselves, are unwilling or unable to do needed self-care, suffer from self-neglect. This can include such things as not eating enough food to the point of malnourishment, wearing clothes that are filthy, torn, or not suited for the weather, living in filthy, unsanitary, or hazardous conditions, or not getting the needed medical care. Common characteristics of a person who neglect themselves are the following. They live alone, more often women than men, depressed or increasingly confused, frail and elderly, people with alcohol or drug problems, and a history of poor personal hygiene or living conditions. Signs to look for in the home include the following: not enough food, water, or heat, filth or bad odors, hazardous, unsafe, or unclean living conditions, major repairs are needed and not done, human or animal feces in the home, hoarding, where nothing is thrown away, stacks of papers, magazines, etc., and animal or insect infestation. Things to look for on the person include poor personal hygiene, if they are unclothed or improperly dressed for the weather, skin rashes or bed sores or untreated medical conditions, if they are dehydrated, malnourished, or unexplained weight loss, absence of needed dentures, eyeglasses, hearing aids, walkers, wheelchairs, braces, or commode, increased dementia, confusion, and disorientation, unexpected and unexplained worsening of health or living conditions, spending too much time alone or isolated from former activities, lack of interest or concern about life, and self-destructive behaviors or significant behavior changes. Also hallucinations, delusions, or the misusing of drugs or alcohol. The definition of self-neglect excludes the decision by a mentally competent older person to engage in acts that threaten his or her health or safety as a matter of personal choice. The term mentally competent assumes that an individual understands the consequences of his or her actions, decisions, and makes conscious and voluntary choices. Social support by family, friends, and members of the community and service providers are extremely important in helping vulnerable adults to remain safe in our communities. Family and friends can assist by helping the adult to reduce isolation as much as possible. Community services such as visiting on a regular basis, regular telephone calls, and volunteer driving to events, church, or shopping. Learning the signs and symptoms to look for. Staying in contact with the adult, listening to and talking to the adult on a regular basis, showing concern and helping them to find solutions. Help a person to understand and consider options and make his or her own choices. Helping the person to accept help from others and to get services needed. Getting others involved by contacting volunteer faith-based groups or other volunteer groups to help with unmet needs. Getting help from Adult Protective Services if an adult is showing signs of self-neglect. And allowing the adult to have control of his destiny by remembering that he or she chooses to be neglectful. He has a right to do so if competent. There's also additional ways that neighbors can help. Staying alert and aware of changes that might indicate a problem with an aging neighbor. Noting signs of changes in well-loved animals, once well cared for and now losing weight or neglected. Noting whether newspapers are piling up on a porch and if there's a change in routine. When concerned, neighbors can knock on the door and check to see if they need help. They can listen and offer support and call Adult Protective Services if concerned about self-neglect. 911 can also be called if the person needs immediate medical help and is in danger of harm. Public service providers can help by staying alert to any changes that may indicate a problem with an aging customer. They may see mail or newspapers piling up, noting significant negative change in the personality of an elder adult. It may be necessary for the service provider to knock on the elder's door to evaluate whether help and assistance is needed. And working together, community members can help our elders remain safe and live fruitful lives. Elder abuse is a crime. As a healthcare worker, you are a required reporter. You must report known or suspected abuse. You will call the office, submit a written statement, and MedSide would contact case management, adult protective services, and the police whenever necessary. There's also additional places that you can report, including contacting law enforcement yourself, adult protective services, and the state licensing agency. This concludes our presentation on recognizing and reporting abuse. Staff responsibilities and communication protocols. Accessing your work schedule. Your work schedule is available online at medside.com. It is managed and updated by your care coordinator. Always follow the schedule as it is assigned to you. If you are unable to see a client at the time you are assigned, you must contact your care coordinator immediately. The visit and signature guidelines. For the visit, do not start the client visit before you actually see the client. The PSA must begin and end the visit at the scheduled time and location of the visit. The client signature is required. Do not sign for the client. The client must sign his or her name at the end of each visit confirming service delivery. Client signatures may be verified against nursing visit signatures. The missing signature protocol. If a signature is missing, the visit will not be processed for payroll. The PSA must call the office immediately to explain the reason for the missing signature. If the coordinator is unavailable, leave a detailed message. And a client or client representative has to confirm the visit with the office representative. The aide has to call the office to speak with the care coordinator right away if any of the following occur. If they're not able to clock in or clock out of the MedSide system, if there's a visit start variation is more than 30 minutes before or after the scheduled time, if you need to stay with the client longer than the scheduled length of the visit, or if you're unable to visit the client at all. This avoids unnecessary calls to you to confirm the services have been provided. Reporting falls, emergency room visits, and abnormal vital signs. You are required to report immediately, even if you are not clocked in, as soon as you know of any emergency room visits, falls, or abnormal vital signs. You will report it directly to the office. You do not need to report it to family members or anybody else of the client. That is the responsibility of your supervisor in the office. You will report by making a phone call. Somebody is available 24 hours a day, 7 days a week. If you receive a voicemail or a missed call from MedSide, please return the call as soon as possible. Prompt responses may lead to additional work hours or urgent updates as needed for client care. You can check your phone after a shift and see if you missed a call from MedSide. Call back immediately. If you receive a voicemail requesting confirmation about tomorrow's schedule, return the call promptly to avoid delays or scheduling issues. Client and caregiver requests. All requests from clients, family, or caregivers regarding care, schedule changes, or additional tasks must go through the office. Staff are not permitted to act on these requests independently. Examples: a relative asks you to administer medication. Report immediately to the office. A client asks you to come early for their shift tomorrow. Report immediately to the office. And a family member asks you to stay an extra hour. Report this and request approval for staying. Do not stay without that prior approval. Requests from case managers. All requests from the client's case managers should go through the office. This includes if the case manager calls asking for client information, or if you are present during a home visit from a case manager and they ask you to change the client's care plan, or if you receive an email from a case manager requesting any documentation. All of these should be the office should be contacted immediately and to forward any requested information to the office representatives. For all communication regarding the clients, including requests, updates, or instructions from clients, family members, caregivers, or case managers, must go through the office. Do not call, email, or text on a client's behalf, and staff may not take independent action based on the outside instructions or requests. Regarding your schedule, if you need to reset your password to access the system, please go to the login page and select Forgot Password. You will enter your email associated with your account and then go to the email to change your password. Once you check your email, there will be a link to reset your credentials, and you will be able to reset your password using the specified requirements, including at least one uppercase letter, one lowercase letter, one number, and one special character. Your password has to be a minimum of 8 characters. MedSide is currently providing a referral bonus to anybody. If you refer your friend or relative to work with MedSide, you will receive a bonus for each referred employee once they work a minimum number of hours or visits. You can go to our website to see the details on how you would request the referral bonus to be paid. And this concludes our presentation.